I'm Marion Ross. You may remember me from stage, screen, and TV. I speak with you now as the spokesperson for Children's Lifeline International. Over the years, Lifeline has sponsored medical missions to 50 countries around the world. The volunteer doctors and medical teams come from America's leading pediatric hospitals and bring their knowledge and expertise to children at no cost to the mission.
Sala has been my patient since I think 1997 when I first put in his pacemaker, and we've gone to be good friends over the years and many times talked about Children's Lifeline, and he has asked me, Ricky, don't you want to put together a mission? And you know, he's very persuasive, Sala. So when Sala says you should do something, then I listen. We were very excited to go, and then, you know, of course you wonder, what am I just gotten myself into?
It was uncharted and unknown territory. When we arrived, it was in the middle of the night, actually the early morning hours. And we took a car ride from the airport to the hotel that we stayed in. It was dark and was a pretty harrowing drive as far as I'm concerned.
I did notice as we were traveling through the streets that the vehicles constantly honking at you, everyone from everywhere, and it seemed like just chaos.
It's a beautiful hospital building. I was so impressed just walking into this really exquisite looking entrance hall, and I was asking about that, and the people greeting us said, well, it's very important that the poor patients who come to us will walk into a hospital and feel like we're going to treat them right.
We were very well received. Clearly the culture was a little different. At places you take your shoes off, and just the different ways that people would greet and the way they would show respect.
The first obstacle we had to get over was a very practical one. They're much smaller than us in India, and the scrubs didn't fit. So we had to go look for scrubs that would fit. There was one cardiologist there who did everything. He was very nice to us, but clearly kind of checking us out a little bit.
It was definitely not thrust in. The first day I just observed, and they did a fairly complex operation, and that gave me the opportunity to see at what level do they function.
We started to warm up gradually because we had a big day the first day there. We did a lot of cases. You know, being a parent, I'd never worked on anybody younger than about 13 years old. And I think our first patient was 6 years old. And I've got a son who's 7, and thinking about, you know, what it must be like for somebody that age to be on the table around, you know, not only, you know, medical professionals from India, but foreigners who were standing around and speaking a different language. The third patient that came in, you know, I smiled and I did the Hindu namaste to the patient, and she smiled at me, and the look in her eyes was just, I will never forget it. She just seemed, I can't even describe the look, but she probably calmed me down more than I calmed her down. We were able to correct her arrhythmia, and I was able to meet her and her father the next day and get a picture with the both of them. And
unfortunately, there are so many poor patients and so many who need so much done that on one hand you're so happy and grateful that you're there to be able to help them, and on the other hand you say, oh, we need so much more. There was one little boy there that I remember very well. He came in with his mom and dad, and his name was Harish. One look at him, you knew that this was a heart problem that had gone too long, and in fact it had. He never came to the point where he was going to be operated on. And you know, those kind of things just break your heart, because you know that there are resources, and we are the resource, and we can come and we can help. And Harish has very poor quality of life, and he has very little life left.
Emotion changed as the week went by, from what are we doing here, how can we help these people, to feeling, yes, we are contributing, and we are making a difference.
We still did twice as many cases, or even some days 3 times as many cases as we would do in the United States. We did some cases that would have been, challenging for anybody, but if it weren't for us, I don't think they would have got them done over there.
I think it was a resounding success. I think we learned a lot. Hopefully they learned some, and I think that we clearly helped those individuals.
We had to make decisions on, well, we only have 3 defibrillators. Who are the 3 patients going to be who are going to get this potentially life-saving therapy? I wasn't quite ready for that.
The way they do things over there is very different than the way we do things here. For example, their director of cardiovascular services would walk into the control room barefoot every day. And that just blew me away. I can't imagine walking around a hospital barefoot, but for them, that's just how they did it. And a lot of the staff wore flip-flops. And don't get me wrong, I love flip-flops, but I never, you can't do that here in the United States.
We were very busy, we were doing case after case after case, but something that I quickly realized was very important is you have to break a little bit and have a cup of Indian tea. And it's really good. And then you sit down and you talk and just take a little bit of a break in action. And it was a great way to get to know the doctors. You'd also like to bring in a component of teaching and education so that when you leave, the people who are there can continue to do what you do. Particularly, I have to say, there was one woman, young woman doctor, and she was the only woman cardiologist at this hospital and in several of the other teaching institutions, and she loved following me around. And she didn't want me to leave, and when I left she said, "Dr. Green, you have really empowered me," and I think those are important things also.
One of the doctors there and I talked about having ongoing video-linked conferences between here and there, either cases that we'd perform or actual conferences where we could continue to educate and update their faculty on the newer techniques. So I think that's something that is a very important aspect of this type of a mission. We can go back and work with them a lot, even if we use remote telemedicine conferencing these days to improve their skills and treatments.
We couldn't do this without Sala and Children's Lifeline, and the work that Sala and Children's Lifeline do to make these missions possible, I can't thank him and the foundation enough.
I think Children's Lifeline is absolutely essential for this mission. This is what made it possible for us to go, and it has a machinery that's in place to send medical missions like this and affect many people. So it was really good to be part of this already well-established mission organization.
We helped 35 patients during the 5 days we were there, and I think for those 35 patients, we really made a difference. Let's really make sure that a boy like Harish can come in and maybe we can, help a few more.
30 years ago, Lifeline primarily provided cardiac care. Since then, the missions have expanded to include many other disciplines: craniofacial surgery and clinical missions which treat malaria, typhoid, and other waterborne diseases. The distressed children of the world need your generosity and support. All donations are appreciated. Remember, through Lifeline, you can bring happy days to hundreds of children around the world.